Good morning and good afternoon. I'm Sarah Felkner, the Associate Director for Research Integration at the National Institute for Occupational Safety and Health at the Centers for Disease Control and Prevention in Atlanta, Georgia. It's my pleasure to welcome you to the virtual workshop, How Will the Future of Work Shape Research Issues, Methods, and Applications? This workshop is offered by the Southwest Center for Occupational Environmental Health, a NIOSH Education and Research Center, at the University of Texas Health Science Center, School of Public Health in Houston. This workshop is part of a multi-year Cooperative Agreement conference grant in partnership with NIOSH entitled Shaping the Future of Work to Ensure Worker Health and Wellbeing, Shifting Paradigms for Research, Training, and Policy. This virtual workshop is centered on how future changes in the nature of work will or should shape occupational safety and health research issues, methods, and translation. We're pleased to have Dr. Paul Schulte join us to discuss paradigm-shifting models for an expanded focus for occupational safety and health research in the future of work. Dr. Schulte is the Director of the Division of Science Integration and co-manager of the Nanotechnology Research Center at the National Institute for Occupational Safety and Health. Dr. Schulte has 40 years of experience in conducting research and developing guidance on occupational cancer, nanomaterials, risk communication, workplace well-being, and genetics. He's also examined the convergence of occupational safety and health and green chemistry and sustainability. He's the co-editor of the textbook Molecular Epidemiology, Principles and Practices, and has served as guest editor of the Journal of Occupational Medicine and the American Journal of Industrial Medicine, and was on the initial editorial board of Cancer Epidemiology, Biomarkers, and Prevention. He's currently on the International Advisory Board of the Annals of Occupational Hygiene. Dr. Schulte has developed various frameworks for addressing the aging workforce, the burden of occupational disease and injury, well-being of the workforce, translation research, synthetic biology, and occupational risk. It is my pleasure to welcome Dr. Paul Schulte.
Thank you, Sarah, and it's a pleasure to be here to talk about the expansion of the occupational safety and health paradigm. It is an anxious time to talk about the changing nature of work and the future of work, because just when we thought people had a beginning vision of how work was going to change, a pandemic comes up and knocks us sideways. And the pandemic is such that it not only is changing work, but maybe accelerating the future of work. So the kind of things that I'll be talking about today may be accelerated to some extent by the current pandemic. The paper that was the basis for this presentation was recently published in an international journal, and it lays out in detail the model that I hope to talk about today. So we understand, and you all who are on this at this seminar understand quite well that the world of work is undergoing profound changes. There's changes in the nature of work, and we've talked about this in many different kinds of settings. There's changes in the organization of work and the intensification of work, and these kinds of changes are driving new forms of work. There's also changes in the workforce. The workforce is aging, not only in the U.S., but globally. There's more older workers. There's more turnover. There's less organized labor. There are more veterans. It's a multi-generational workforce. There are more immigrants, more women. And as a backdrop to the workforce is the issue of more chronic disease. And maybe the role of chronic disease as a cofactor with occupational hazards is something that we haven't dealt with that much in traditional occupational safety and health, but should. Indeed, you can see that the cost to society of chronic disease is immense. Moreover, the amount of economic output that's foregone due to chronic disease is rapidly growing. So the workplaces are changing. And the changes are in the types of jobs, the relationships of employers to workers. There's more small businesses, there's more service jobs, more telecommuting, more work conditions, a variety of different kinds of work plans and new work contracts. And then superimposed on that is the impact of pandemics on work. There were many predictions that a significant pandemic will occur, but it's, and we've just finished reviewing the future of work literature. There's little mention in the future of work literature about pandemics. Mm-hmm. And so the long-term impact of pandemics on work is not well known, but we expect that it will have, as I said, a possibility of accelerating current trends. Well, while we're going to be talking about new hazards and new scenarios in the future, we'll have to remember that the workplace is a mosaic of hazards. And so while there'll be new hazards, there still will be the classic traditional hazards in many areas that we have studied for decades in occupational safety and health. And so we'll have to address both these classic hazards as well as new hazards. And so what we're going to need with all these changes in work is an expanded focus for occupational safety and health. And so we proposed a broader view, and we use the conceptual framework of vertical and horizontal, so a broader view of the burden of occupational disease and illness and distress vertically and horizontally. The need for a transition is critical because we're coming to a place where we need a more comprehensive view of the burden of work and work-related adverse effects. In the traditional occupational safety and health paradigm, we focus on the identification and elimination of risks associated with work, specific hazardous risk factors, usually one at a time. And in many cases, we only focused on injuries historically, with surveillance systems largely injury-focused, but not capturing occupational disease. And this led to a somewhat narrow view of occupational safety and health, injury and illness issues, and an underestimation and under-recognition of the burden of workplace injury, illness, and disability. To this day, we still have that underestimation. Now, the current focus of occupational safety and health, familiar to all of you, usually involves these kinds of factors, these different hazardous areas are what we focus on in our research and often in our practice. But if we take a comprehensive view, we will need to include 4 different areas of consideration, and these are what I'll be talking about. So multiple domains of burden, everything from the individual worker through their family to society. A broader view of work-relatedness of disease and injury, not just the classical response to an occupational hazard, but the role of work in exacerbating an occupational injury or illness. We need to think beyond the individual job to thinking along the entire work-life continuum. And finally, to capture all of this, these changes, the differences that we're talking about, we need some overarching characteristic. And the concept of well-being, which is large and rich literature, is increasingly being thought of as applying and applicable to occupational safety and health. So let's go through some of these, each of these in detail. First of all, there are multiple domains of burden. So as I said, there's not only the worker and the worker's family, there's also the employer, the community, and society. And the aspects of burden are affecting physical and mental health, but also economic loss, opportunity cost, emotional cost, and impacts on productivity and sustainability. So there are many factors in the multiple domains of burden, and we'll get back to talking about the research needs to make sense out of all these factors. So here is the model that we are promoting in this discussion. It involves not only just the traditional occupational safety and health approach on the left, but it goes through what we call the horizontal expansion, where it's the traditional plus the understanding of the role of personal risk factors and the understanding of social and economic risk factors. And then there's the vertical, which I'll talk about in a moment. So let's look at the horizontal. In taking a broader view of the role and impact of work, it's important to realize that many of the most prevalent and significant health conditions in workers are not caused solely by workplace hazards. And these examples of these include stress-related conditions, cardiovascular, psychological, musculoskeletal disorders, obesity, depression, substance abuse, and violence. These have both occupational and non-occupational causes. And in fact, while it was good in the early days of occupational safety and health to separate work and non-work, that is somewhat of an artificial construct. It's born out of the classic labor or employment contract, but at least it involves compartmentalization, which leads to under-reporting or under-envisioning the actual burden on workers and on society. And it's clear that the boundaries between work and non-work are increasingly porous. And we talk about work-life balance, and indeed there are many issues that go from work to go from work to home and home to work. And so we need a broader consideration of the interaction of work and non-work factors. The classic occupational disease and injury model shown on the left is based on the primary causal relationship of chemical, physical, and biological risk factors, in some cases psychosocial risk factors, on workers, and generally focuses on a single identifiable and measurable exposure in the workplace. Examples of mesothelioma and coal miners, pneumoconiosis, and they're directly attributable, respectively, to asbestos or to coal dust. So it's the one exposure approach, which has served us well in making advances in controlling occupational disease. But there is a broader view, and the World Health Organization in the early 1980s started to promote the concept of work-related disease and injury. Diseases in the working population in which the work environment and the performance of work contributes significantly, but is one of a number of factors to the causation of disease. Causation of new or aggravation of existing disease of a non-occupational origin is also a critical feature. And their work is the aggravating factor. And an example could be musculoskeletal disorders. So now we can look at the vertical expansion part of the model. And indeed, it has two major components. One, as I said, is thinking about the working life continuum. Historically, in occupational safety and health, we focused a lot on thinking about hazards in a single job. But now it's incumbent upon us to think about not only a single job, but all the jobs that a worker has throughout their working lifetime. Clearly, in each job, there are occupational hazards and risks and work-related hazards and risks. But there's also the edge of the job leading to unemployment, the anxiety that a worker might have of losing their job, the precarious nature of the work. And so we're suggesting that the occupational safety and health community needs to focus not only on each job, but on all jobs and the spaces between the jobs. So unemployment, underemployment, the anxieties of not having work, of having work, losing work, the anxieties of getting new work. And we know that increasingly people are going to have more jobs in their lifetime. Also, when we get to the area of post-work and retirement, it is not a one-phase activity. It's a blended activity where people go in and out of work often many times. And with the aging population, we're seeing a lot of variation in the work arrangement at the upper age end of this continuum. Also, we need to focus on the pre-work and the school training of young workers and new workers. And indeed, we've been promoting the concept of fundamental core principles in occupational safety and health that every student should be taught as they embark on a working career. This slide just illustrates the number of jobs that people are experiencing. It may well be an underestimate. It looks like about 12 jobs in a career, but this is a truncated career time frame 18 to 52. And indeed, many sources in the literature expect that there'll be many more jobs than this. The spaces between jobs that I mentioned is when a person is unemployed, and they can be unemployed for a variety of reasons, but unemployment has extensive physical and mental health effects. And the job loss increases the odds of fair or poor health by 54%, and it increases the odds of new health conditions by 83% among those with no pre-existing conditions. So this is a significant impact on the health of the worker and the workforce. Also, the whole concept of underemployment occurs within a job and in some cases is the driver for people having many jobs. And underemployed workers, underemployment can be of various types. It can be hours-based, income-based, skill-based, or status-based. But in any event, it's been shown to have lower levels of health and well-being, and it seems to have health effects more like those of unemployment than of adequate employment. And so this is an area that has a growing literature, but certainly should be a focus for occupational safety and health researchers. And indeed, the kind of research that's needed is to answer questions like, to what extent are effects in one job impacting effects in another job? To what extent are all of these effects cumulative? What role does the various components of employment and underemployment play, as well as unemployment? And so indeed, this is a framework for beginning to ask a variety of research questions, and the need for various developments in longitudinal models. The other part of the vertical expansion is utilizing the concept of well-being. As I said, well-being is, we've seen many changes in the world of work. And the question is, how are we going to get our arms around those changes? How are we going to envision them and conduct research and develop policy that relates to a broader view of all these changes? And so there have been a variety of approaches for comprehensive measures. One is the NIOSH Total Worker Health Program, which it begins to define and operationalize a framework for achieving worker well-being. And the Total Worker Health Program is designed to support policies and programs and practices that integrate both worker protection and the promotion of injury and illness prevention efforts that will advance total worker well-being. And in fact, NIOSH is in the process of field testing an instrument to measure well-being domains. And this begins to get to the question, and it is a research question, of how do we measure an expanded view of burden? I showed you that slide of all the different components of burden: the worker, the worker's family, the employer, the community, and society, and all the different characteristics underneath that. The question is, how do you integrate those in a way that you can then follow over time changes in burden and essentially then tie that to well-being? Now, well-being is a concept that has, as I said, a wide literature in many different disciplines, but it has been generally linked to lower healthcare costs, reduced injury, reduced illness, lower ratio of absenteeism and presenteeism, and increases in productivity at the worker, enterprise, and national level. The NIOSH approach to looking at well-being is to try to capture these things in 5 domains: the physical environment, workplace policies and culture, health status, work evaluation and experience, and impact from home, community, and society. And so this is the model. There's currently an instrument that's being designed and should be made available for use in research. But the question is, how do you use well-being? How do you use the concept? How do you use constructs that measure well-being in research? Do you use it? Can it be an independent or dependent variable? And what kinds of designs would you need to start to assess it? Clearly, there are a lot of biasing factors in the study of well-being. It has subjective and objective components, and indeed it's difficult to figure out the best way to capture it and use it in research. Can you do interventions research that can look at changes in well-being as a critical outcome? And then ultimately, you want to be able to use the results of that research in both practice and in policy. And certainly in policy, can you make target or goals related to well-being? Can you have a standard that says every worker will have to have X amount of well-being? Clearly, some of that seems a bit far-fetched. But on the other hand, if we follow the construct of well-being, we see that it is a way to capture a lot of the diverse things that affect workers. And so we have to start thinking about using it and there's a growing literature pointing that out, and this would be an area of major research in the future. Additionally, the expanded focus that we're talking about then would require new skills and competencies for the occupational safety and health professions. And indeed, we need to expand the training of occupational safety and health researchers and practitioners. We need to think about how we're going to engage other professions to expand the focus of occupational safety and health. And we then may need a combination of both of those things. In this slide, you see the model, and below it you see on the left the traditional skill sets, and on the right a view of the new skill sets that need to be either taught or related to as we prepare the occupational safety and health practitioners and investigators of the future. Some of those new skill sets are already in use in occupational safety and health, but often to a lesser extent. We also need to think about how we're going to foster collaboration among different professions. The collaborative approach can be categorized according to multidisciplinary, when it's people working in different disciplines, but in parallel, interdisciplinary, when people are working jointly, but still from a disciplinary specific basis to address common problems. And then a transdisciplinary approach where researchers and practitioners work jointly using a shared conceptual framework to address common problems. And we suggest that the transdisciplinary approach needs to be the one that is pursued. And how you do that is not only a research but a practice question. And indeed, for transdisciplinary research, we need to have a process where team members from different fields work together, where they respect the paradigms of the different fields and look for a synergy rather than a competitive or parallel approach. So finally, the future of occupational safety and health research and practice is going to be widely affected by the changing nature of work. We're going to need a holistic view. We need to expand the traditional view of occupational safety and health, of the burden of occupational safety and health, disease, injuries, and distress, to be broader and both horizontally and vertically. We're going to need new skill sets to identify and measure an expanded view of the burden. We're going to have a research view that has a futures orientation, that thinks about how work is going to continually change. It's changing more rapidly, and how we're going to be able to be there to investigate risk profiles in all new technologies. And a lot of this will require the disciplinary approach of systems thinking. Systems thinking allows us to think about a variety of different factors and how they all tie together. This needs to be a critical core of the training of occupational safety and health professionals. So with that, I thank you. One other thought that I wanted to say was that the occupational safety and health community has been under assault in many ways in recent years. Many programs, both in academia and in industry, have been diluted or defunded in some ways, and there's a need for thinking about occupational safety and health in a new light to obtain a stronger prominence. And that new light involves positioning it in the mainstream of dealing with critical national problems and even international problems. And so we need to be thinking about structuring the training of future professionals and the building of new research to think about more of a systems approach to what the national problems are, and then a broader view of understanding what the burden is. And then we need to investigate how best to actively market that to decision makers and ultimately to prospective students. Both of those are the people that will influence the growth of the field, and ultimately our ability to better protect workers will depend on a growing, relevant field. So with that, I'll stop and thank you for your attention.
Thank you very much, Dr. Schulte, for that discussion of the need for an expanded focus for occupational safety and health in the future of work. That concludes this presentation. Please be sure to view the remaining presentations and join us on June 4th, 2020 for a live virtual discussion of these paradigm-shifting issues and opportunities. Please see the workshop orientation materials for more information on how to join that discussion. Thank you, and be well.